Doctor, what do we know now about COVID in grade school aged children that we didn't know a year ago?
A year ago was January 2020. Okay, so at that point in time, we weren't really sure what was going on with kids. It looked like the kids were actually tolerating the infection pretty well, and that is something we really now know for sure. The kids have, in fact, been able to tolerate the infection remarkably well. In our practice, we've had about 30 kids positive. Of those 30, many of them have been asymptomatic. We have not had one kid admitted to the hospital for any reason. We've also had no complications. There's a thing called the MIS-C, which is a multi-system inflammatory syndrome that occurs in children, and similar to Kawasaki's disease. We have not seen one of those in our practice. I'm thankful about that. But anyway, overall, I can say that kids are tolerating they're tolerating the infection, number one, very well. When they do get sick, they're not significantly sick. I'm talking about younger kids. The older teenagers, they do in fact get a little sick. Okay, if you're teenagers, they're getting sicker, but even those kids, the teenagers, are not requiring hospitalization. And so I think that I'm happy about this. I do think as a result of the fact that kids are really tolerating the infection well when they get it, that they probably can go back into school without fear. And the other thing too is they're really not super spreaders. They're not the ones who are getting infected and then infecting other people. As a general rule, they're not passing the infection on that much.
What are your main concerns you have now about kids being kept out of public spaces, if any?
Okay, well, clearly the further you are apart, the less potential you have for infection. That goes with any infection, whether it be COVID or flu or whatever it may be. I think the kids should be out there. I tell families every day that their kids need to go to the park, they need to be involved, go to the beach, wherever they're hiking in the mountains. These are all important. My concern right now is that kids are not getting enough exercise. So that's kind of the reason why I'm telling people to get out of the house and get some fresh air. So public spaces in general, I think kids can be there. I do, just because of the optics, I suppose, we wouldn't recommend, them going to crowded areas. Frankly, there are no crowded areas. I can't find a crowd to save my life. So anyway, I think that in general, yes, there's less of a concern for infection in communities that have more open spaces. Some of the suburban communities are not having as much infection as, say, some of the areas downtown where people live in smaller apartments, multi-families, kind of sharing apartments. Some of the immigrant families are dealing with that. I think you know that. So when you have any kind of dense population, you're going to get higher levels of infection. By the way, that goes for any infectious disease, whether it be COVID or the flu or the common cold. You're going to have higher potential for that. My feeling is that kids can tolerate school. They would love school. There are many things that you can do to mitigate infections. In schools, we're talking about distancing, and if they can wear a mask. I don't care if they wear a mask in the school, that's fine. The important thing is just to have them with their friends, to have them with the kids that emotionally and socially they need each other. We all need each other. And so I think that they can go back to school relatively safely. Actually, there are a lot of schools that are going back part-time even right now. Some of the kids are going, potting up, and I think they're gonna begin to open up some of the schools. I do find that the public schools, because of the power of the teachers' unions, which are trying to resist kids going back to school, that's gonna be a problem. But that's more of a political thing more than anything.
Do you see any health risks with kids wearing masks while engaging in intense physical activities or playing inside or outside?
Physical activity or playing, I don't think there's necessarily a health risk. I mean, they are rebreathing their air when they're running around. Look, I don't know if you need to have a mask outside in general. But if the requirement, if the coaches and the other groups are demanding that, okay, fine, wear a mask and play soccer. I think it's a little bit of window dressing, in my opinion. I don't think it makes all that much difference, but go ahead, and if that's what it requires, if that's the price of admission to get out and play and have a game of soccer or basketball or whatever, do it, because it's more important that the kids are outside running around getting some exercise.
For how long into the future do you expect the psychological health changes from social distancing to be impacting our kids?
Our kids. Here's the wonderful thing about kids. Kids are very malleable. They get better. They really do. And I think that the overall effect, when we get kids back into school, we get them back into a normal living life, they're going to snap back like that, because that's the nature of kids. So I don't think you're going to have too many lingering negative effects. Certainly in the middle of it, there's a lot of anxiety, there's a lot of depression, there's a lot of they're just not happy. They're just low. Just spent a moment with a teenager a minute ago, just my last patient of the morning, who is feeling very depressed and blue about not being able to be with her friends. But when they get back, they're going to be fine. And I don't think you're going to have a lot of residual negative effect with that. Number 5, besides remote learning, which social distancing habits should we be trying to end as soon as possible? Well, I think that social distancing, here's what I think. I think when the vaccine is more widespread, when they're out there, people are getting them, you're going to see the overall fear factor go down by a huge amount. And the people are going to begin to return to normal behavior and normal activity level. How long it'll take before the mask goes away, I don't know. I think that would be nice, because frankly, I think that it's kind of weird to have people walking around with masks. You really don't know what they're thinking per se. You don't know if they're smiling or yawning or laughing or what they're doing. And I think that that's something that we as human beings need to have, to be able to read people and to socially interact appropriately. So that would be a nice thing in terms of other things other than social distancing, which I presume you're meaning like they being 6 feet apart. But anyway, that would be nice if we could actually definitely do that. I think step number 1 would be stopping the mask outside, because people outside are walking around with a mask on everywhere. I don't think you need to have a mask on outside, frankly. Most people who are outside are staying away from each other, so I don't see great benefit from that.
Looking forward, what specific issues should parents most be concerned about when it comes to helping our kids adjust to a possible second year of social distancing and remote learning?
Well, God forbid we have another year of it. I'm thinking that probably by 2021 in the fall, things are gonna get better and they're gonna change. So that's my expectation. But other issues, here's what I'd recommend to parents. You got to get your kids outside, involved in life, traveling as much as you can. Keep them as normal as you possibly can. Keep them off of televisions. When they're doing their Zoom learning, okay, they're Zoom learning. But when they're not Zoom learning, keep them off of social media. Keep them off of, they need to get out off their chair and get some exercise, okay? And whatever that means, with swimming or running or walking their dog or riding a bicycle. I can think of a lot of things, but those need to be done. All right?
Doctor, thank you so much for your time today in helping answer these very important questions.